Thank you, Mr. Chairman, and I appreciate this conversation, but I guess some people have forgotten the reality of what's happened in the last 7 years. Insurance premiums have skyrocketed. People that look at this bill, most of them recognize when you actually free people up to make their own choices in health care, of course costs are going to go down. Because unelected bureaucrats in Washington, elitists, when we saw some of these hearings with Secretary Sebelius years ago, when I presented her case after case of constituents of mine who liked what they had and wanted to keep it, and yet were losing their plans. And I asked Secretary Sebelius there under oath, and I said, what would you tell that family that just lost their plan? And she said, oh, well, they must have had a lousy insurance policy. Well, first of all, they didn't think it was a lousy insurance policy. They liked their insurance, and they were promised by her they were going to be able to keep it. And when I told her that, she said, oh, don't worry, you can go to the Obamacare website and find a better plan. And during the hearing, I went to the Obamacare website, and the site was down because it didn't even work after over $500 million of taxpayer money. Let's not forget those facts. That's what's happening in health care. People are paying more. Let me read you from some of my many constituents who have shared their story with me, real stories about not what's going to happen tomorrow, not what's going to happen next year, what's happening now. I'll start with Pamela from Mandeville. My premium went up from $986 per month with a $4,500 deductible to $1,346 per month. This plan is required to have maternity and pediatric vision. She's 57 years old. I'm so frustrated, I just can't afford this anymore. This is as much as my mortgage payment. Ida said, I am on my 4th carrier. My co-pays have gone up, and so have my premiums. I lost my doctor the first year. Where was that promise that was made to her, by the way? And I have to drive to a different city to do blood tests. Here's another.
Mr. Chairman,
our health insurance premiums have gone up more than $1,000 per month, while out-of-pocket deductibles have skyrocketed. Our premium of our family of 4 is more than our mortgage. We were not financially able to keep our health care, so for the first time in my life, I am without health insurance. We are now forced to pay a fine because we cannot afford this astronomical premium. That's Christy from Slidell. These are real people, and you're not going to interrupt the reading of these real people because they're fed up with this law. So when you talk about higher costs, these are the higher costs people are paying today. When President Trump said, I'm going to rescue you from the failures, these are the failures. Let me read you Richard from Abita Springs. I'm a veteran and Medicare. My wife at age, and he says, I'll probably be in trouble for telling you, is 63 years old, had good insurance with a $50 deductible, full coverage for $375 a month. The next year, Obamacare made the new policy jump to $789 a month with maternity and child care and a $6,500 deductible. This is a 63-year-old veteran. The next year, the insurance company pulled that policy and wanted to raise everything again with a different policy with a larger doctor visit copay. Let's look at the map. Here's a reality check. Do you want to talk about higher premiums? I sure do, because these are the higher premiums people are paying today because of Obamacare. Look at Arizona, over 100% increase. The state of Alabama, 58% increase. Tennessee, 63% increase. This is what families are paying today in increased costs of health care because of the unworkable mandates and taxes in Obamacare. So yeah, we're bringing a bill to provide relief so that we can actually lower costs. Now let's talk about choices. We can go to the next slide. On the next slide, we're going to see just what's happening to families in terms of their choices for health care. We're hearing all across the country of fewer and fewer choices in many places, most parishes and counties across the country, where we're seeing a growing trend of only one provider in those states. One provider means a monopoly, and you wonder why costs are going up, because there are fewer and fewer choices for families out there. Costs are skyrocketing. Deductibles are going through the roof, and families are losing care that they had that they liked. This law doesn't work for families. Our bill actually puts patients back in charge of their choices. If you don't trust families to make those decisions, I can see why you would oppose our bill. But for everybody else that wants to actually be in charge of their health care decisions again, who's smarter than unelected bureaucrats in Washington and who are ready to have that freedom that we're going to give them a shot, because
Gentleman's
look at what's
time.
happening right now to the marketplace because of the
Gentleman's
failures of Obamacare. Let's provide that relief
Gentleman's time
and get
has
on with it. I
expired.
yield back the balance of my time.